The most common question that patients ask me about hair transplantations is, Doc, is it going to look natural? I can tell you right now, right off the bat, that absolutely yes, it's going to look natural. How do we know that? Well, I'd like to say it's because I'm the best surgeon in the world or the best surgeon there ever was, but it's really about how we place the grafts, what type of grafts we use, and how we follow nature. So I can tell you for sure because we use the proper methods, the proper types of grafts put in the right way. So let's talk about some of these details. The basic graft that we use these days is follicular units. That is single hairs, but it's also groups of 2 to 4 hairs that naturally grow on your head. That's how nature put them up there, and that's how people with no hair loss have their hair. So the recognition that that's how nature grows hair was the big revolution about 25 years ago, that that's how we should be transplanting hair. We plant grafts using follicular units only. That's how hair grows, and that's how we create a natural head of hair. There's other considerations as well, and that is angles of the hair, the direction of the hair, flow patterns. So the surgeon has to be able to mimic nature and address all those. Now, if a patient has some existing hair on their head, we follow those angles and directions. We don't create something new or something different than they already have. If they have no hair on their head, we create something that's very flexible, that the patient can part their hair or wear it straight back, but we follow the general rules of nature. The other thing people ask is there going to be a wall of hair, a line of hair? So oftentimes during a consultation, they want to know, where's my hairline going to be? We typically use a marking pen or some type of marking device to show approximately where the hairline is going to be. But when we draw that, the patients get the impression that we're just going to follow that line directly, and that's not the case at all. What we're doing is using that marking as kind of the average location of a hairline. But in reality, when the actual transplantation takes place, and assuming the surgeon has experience and knows flow patterns and knows how nature does it, what we do is create natural patterns of irregularity at the front of the hairline, and we create the density patterns as they occur in nature. So at the very front of the hairline, you have kind of a finer result. In other words, there's a little bit of see-through look, and as you go further back into the hair, it gets thicker, and that's how we create a natural pattern. We're using grafts that have single hairs right up front, behind follicular units with 2 hairs, and then behind that, where we want to create higher density, we're using 3 and 4 hair follicular unit grafts. And in this way, we can give you something that mimics nature. Now, again, a lot of this depends on the surgeon's capabilities, their experience, their attention to detail, so you really want to go to a doctor that has the experience in doing this. I have a lot of patients that say, look, Doc, I hear what you're saying, I understand what you're saying, but I've seen guys out there with the plugs. I know those are transplant patients. But here's what I want to tell you. The reason that it looks pluggy is because that's how the surgeon transplanted the grafts. They didn't use naturally occurring follicular units, and in fact, they used plugs of hair, and that's why it looked pluggy, or doll hair lookalikes. So what's important is you go to the doctor that has experience, that only performs follicular unit transplantation, and if they have the experience and the knowledge, they'll give you a transplant that looks absolutely 100% natural. And it's unlikely that anybody you know, family, friends, or your hairstylist will ever know you've had a transplant.